Hey, everyone. Hey, it's Dr. Tamara Beckford with Your Caring Docs, where we provide you with some great health and wellness info so you feel empowered, you know what's going on. And we have a great special segment. We have our Your Caring Docs, Docs Who Cares, right? These are docs from all over the world who are going to enlighten you health and wellness info. And they're going to leave their information so you can get in contact with them if you would like to be part of their team, if you'd like them to treat you, because these are the best of the best. Today, I have one of the docs who care. And let me tell you this. It's one thing I love about this doc. So I put out and I'm like, hey, would love to have some docs to just give some information for people just so they understand. And she's like, me. Listen, I always wanted to make sure that all our patients and everybody knows about their screening and what the CDC guidelines are. Let me come on and so that I can share all this info. I mean, straight, complete, unsolicited. So you know you're in good hands with this doc right here. This is Dr. Nikita Shah, representing from the she's in the which is Orlando, Florida area. Woo! All right, Dr. Shah, welcome. How are you?
I am good. I'm so happy to be recording this for you and your audience. It's such a blessing to be here. Thank you so much.
We are happy to have you. Now, I'm going to give you guys a quick look of background on Dr. Shah, and then I'm going to let her drop all of that gem that she has packed right here for us. So Dr. Shah went to Lake Erie College of Osteopathic Medicine in Bradenton, Florida. Then she did her residency in family medicine at Florida Hospital in East Orlando. But because she is so awesome and she knows what's going on in the world and she wanted to help a lot more people, she decided to get additional training in obesity medicine. So she's obesity medicine certified, trained family medicine doctor right there in Florida. I'm telling you, if you guys know anyone or if you yourself need an excellent doc in the Florida area, Dr. Shah is your person. Because like I said, she's just like ready to just really drop a lot of gems on us. Today, we're going to be talking about some of that screening. Come on, Dr. Shah, let us know what's going on with screening, and actually, what really is screening? What is that? Let me know.
Yeah, so for me, if you come to the doctor, usually most patients think that all my doctor is doing is asking these questions and has these labs. And what are they for? So why do I need to go?
So nosy. Why are you asking me if I smoke? That's not in any of your business. Does that have anything to do with today's visit? Come on, Dr. Shah, let us know why it's so important.
Absolutely, because if you smoke, you could be at risk for lung cancer, and we need to be able to screen you and treat that earlier. If you're planning pregnancy, I would love for you to stop smoking because that's a great time to stop smoking. If you need medications to help you smoke, like no judgment from me, it's a problem. If you want to quit, I'll help you. A lot of the other things we deal with obesity medicine specifically is a lot of lifestyle changes. So to me, it's very important. It seems simple, right? Like if you are exercising, sleeping, or even if you're not, my job is to make sure you know what you need to be doing. And if you're not doing it, let me guide you along the way. Because until you make time and carve it out to connect with me or your doctor in general, we're not going to really recognize the impact that sleep, your nutrition, and everything is having on your overall health picture. Heart disease, heart attacks, strokes, mental health.
Right.
It's so much more. And then the blood work is just a piece of it. So yes, you can go get your labs, but you really need to be having conversations with your doctor and getting your vital signs assessed, just so you have our undivided attention and we can guide you through this.
So, one of the things we notice with people overall, right, especially people who have kids, we make sure that the kids get all of their doctor's visits, their annual visits, their screenings. However, a lot of times we end up neglecting ourselves, right? So as an adult, at what age would you recommend an adult start getting screening, right?
I say as soon as you pick up the phone, and if you haven't been screened, you need to be screened. You need to go for your physical. So oftentimes people will come to the doctor when they have a problem, but screening is for the things that we don't even know we have a problem in. That's what screening means. So if you're an adult, if you're 18, 19, 20, please come and see your doctor. We start looking at high blood pressure at the age of 18. We start looking to see, like for women, right? Like we start talking about gonorrhea and chlamydia screening if you're sexually active. We want to make sure that you're taking a prenatal vitamin. If you're of reproductive age, make sure your future baby, even if you're not planning to have a baby, is okay. We can talk about birth control. Maybe you don't want to be pregnant right now. Maybe you've just been reading on Google, Dr. Google, right? Like
Right?
what type of birth control is right for you. But let's go talk to your doctor about that. So I say at every season of life, every year, you should be connecting with your doctor. And we'll guide you through the process. It shouldn't be a chore. It should be like painless. But there's a lot of nerves and apprehension going up prior to that visit.
Absolutely. So, one of the things that as doctors we often hear is, I'm not sick. I feel fine. So
Yeah.
why are we, asking me to go to the doctor and every year I don't even have issues? So, Doc, I think you have, didn't you? I think you made this really good slide for us that you wanted to share. Like I told you, she is a gem. She put together a slide of all this great info that, she wanted to share. Dr. Shah is the real deal. So let's see. And here we go. So the screen is coming up. Here we are with some wonderful info. Alrighty, Dr. Shah, let's unpack all of this. Break it down.
Yeah. So generally speaking, right? Like we all feel well. The body does a great job of making you feel good. So high blood pressure, if we look right here, we talk about blood pressure being the silent killer. Starting at 18, we should check your blood pressure and make sure you're ideally less than 120 over 80 and that your blood pressure is controlled. Don't worry if it is high in the office. We'll talk to you about it. We'll show you how to check your blood pressure at home. We'll follow it up. The next biggest thing is diabetes. So by the guidelines, between 40 and 70, we should screen for diabetes. For my patients, and I think for a lot of physicians across the country, we include the hemoglobin A1C, which is the 3-month blood sugar average, and also the glucose check on most of your blood test when you come in for your physical. Yeah, you'll feel well, but we all know at times, and we've all had these patients where they feel great up until just a few days before the visit, which probably prompted to make that visit. And we have a new onset of severe diabetes. Purpose of screening is I want to catch you before you actually have diabetes, before you actually have high blood pressure, before you actually have heart disease. I want to connect with you and help you when you have pre-diabetes, pre-hypertension, or what I'll say is pre, like before the disease even starts. Like, so weight, and the reason I'm so passionate about weight is before the disease even becomes, I will start looking back 10, 20 years and think, what could have we done back then to prevent all of these conditions so that you can live your best life? So that's why that piece is so important to me.
Wow. So we're talking about screening, especially how important it is for us to try to get the screening done to prevent some of the onset of these diseases, right? So we've just talked about the screening for high blood pressure and diabetes, and we said that screening really begins when you become an adult at 18, right? Now, this screening really doesn't mean that you're going to immediately be placed on medication if you don't need to be. We want to be able to have a baseline so you can be tracked. And if you are in a pre-danger zone, you can be notified immediately, and let's get you out of that zone back to the healthy zone, right? So what are some additional screenings that, I see something about colon cancer. Now, that's a big issue. That is another silent issue that's going on out there.
Yes.
So, yeah.
So colon cancer is huge. So oftentimes, patients are really apprehensive because they're like, it's time for me to get my colonoscopy. And it's like this icky thing. Like nobody wants a camera inserted up their colon. But you know what? If you have direct visualization of your colon, you might be good for 10 years. And that's just peace of mind to me. I know people, personally and also professionally, that have died of colon cancer way, 40s, 50s. And I believe the screening needs to be done. There is a stool-based testing available. So if a person is at average risk for colon cancer screening, meaning they've never been diagnosed with colon cancer, they don't have any colon polyps, they don't have inflammatory bowel disease, no personal or family history of genetic disorders that place them at a high lifetime risk of colon cancer, such as familial adenomatous polyposis and Lynch syndrome. Then we can do stool testing. I think the most common one that's advertised is Cologuard testing. And listen, for me, if I just want the patient to have the screening, I want some peace of mind. If the colonoscopy, you can't schedule it, you can't get there, it just gives you the heebie-jeebies. We poop every week. Just send it in the mail. And connect with your doctor.
Describe the poop to the doctor if it changes. Send off the test.
So send off the test and let's just get it screened. So colon cancer is huge. And we should be screening more. The other big thing, just along with cancers in general, is we'll talk about our cervical cancer screening. I think most women are aware that we need to screen the cervix for cancer. So the two tests that can help with diagnosing or evaluating for precancerous lesions are your Pap test, and your HPV virus testing. So starts at 21. If everything's normal, every 3 years, you can get screened with cervical cytology or the traditional Pap. After the age of 30, you can move at intervals of 3 years or 5 years, depending on the test. My preference in Orlando, and I think that's just our local standard of care, is we co-test, meaning we do the Pap testing. In addition to that, we also do the HPV testing. HPV is the virus that is known to cause cervical cancer. And it's a great way to screen us women so we don't die from something that's completely preventable and treatable.
And I would like to interject and add, I'm an ER doc, so I do unfortunately at times see the worst ends of what occurs. And also I'll see patients who come in for regular, issues, and then I ask some of these questions, right? One of the issues that I have noticed is that a lot of women really believe that they only go to their gynecologist to deliver their baby. And then after the baby's delivered, that's it. So it's important to know that although that baby is delivered, I know Johnny is now 9, 10, 11, 12. 12 years ago should not have been the last time you went to see your gynecologist. You still need to go and get either to your family practitioner who does the screening or to a guy, but you need that gynecological exam. So that's important.
Exactly. Yeah. And then moving just from the cervical cancer screening, move up. So I think breast cancer screening definitely is on the radar for people. So there's a couple of other things that we need to know about breast cancer screening. So the United States Task Force for Prevention recommends that patients and their doctors have the discussion about what type of screening an individual woman needs. The baseline guidance is starting at 50 every 2 years. Within my patient population, I generally start having the discussion at age 40. And generally, I don't have a lot of pushback from people, but we really have a conversation. So I say, let's do 40 in every year. if there is no family history of breast cancer, some other things to take into consideration is the reason we screen for breast cancer or colon cancer or cervical cancer. It's not because you have to have a family member with these conditions. We just as individuals develop these cancers, and that's why we screen. If it was just people who had a family history, we actually would only screen those people, but most people don't have a family tie with breast cancer. If you do have a family history of breast cancer, we can start talking with your doctor about, do I need to have ultrasounds based on my breast density? Some women have denser breasts that just the mammogram itself obscures the picture, so an ultrasound might be beneficial to them. If there's a genetic history or several members in the family with breast cancer, maybe an MRI is necessary for you as well. Again, over a talk, I can't tell you, but there are assessments that need to be done, and this conversation can be had. But certainly it's not just simple as everybody gets a mammogram at 50. There's some, the art of medicine is involved in these decisions.
Wonderful. I love that. It's the art of medicine, not just the one size fits all.
Exactly. The other big thing, and especially 2020 has been such a hard year, is your doctors want to know how you're doing emotionally. Depression screening, mental health, like we want to talk to you. We want to hear from you and really know what's going on. Because once we know, then we can help you, connect you to counselors, connect you to support centers. Maybe you need a medication. Let's just start talking about it.
Yeah, even to just get you through a transition point, not saying that you might need to be on it. So there are, just to get you through a transition, a grieving period. There are a lot of people who have lost loved ones during this time. So you might not just be dealing with the anxiety of this pandemic that's still there, but some people have lost loved ones. They've lost multiple family members, and you're grieving. And sometimes through a grieving process, you might need a little bit more help. And that's what we're talking about when we said if you might need medication, for a transitional period, right? Yes. So, alrighty. So now we're on to some other screening. Go ahead.
Yeah. So, for reproductive age women, and what that means is basically women who started their menstrual cycle. And so generally we're talking like teenagers, young 20s, early adulthood. So at those times when you're talking to the doctor, this is why I say you need to start going as soon as you're an adult. We might ask personal questions because we know that there is a chance that you might be being harmed, correct? Like there might be intimate partner violence, there might be some abuse, and this might be that opportunity for us to approach the subject and to get you help. So we might touch on that a little bit during these visits. Another thing is STDs. Gonorrhea and chlamydia and syphilis are on the rise right now. Absolutely. On the rise. And the unfortunate thing is for us women specifically, if we have these infections and they are undetected or not treated, it's going to affect our organs like our uterus, our pelvis, our ovaries. It puts us at increased risk for pelvic inflammatory disease, which is just a very painful condition to deal with. And it's very treatable. Like you're not a bad person if you got an infection, we can treat it. And that's the importance of screening you and then treating you.
Absolutely. And it can also lead to infertility, which is important.
Yes.
Too. But although you might not, be in the point where you want to start a family at that point in time, maybe later on you will. And you don't want to find out that this preventable or treatable infection is one of the reasons why. So that's an additional reason to go get that screening. All right.
Yeah. And then I think the biggest, the most important feedback I have when I'm talking to my patients is I'll recommend just start taking folate, like your prenatal vitamin.
Yes.
And I get this thing like, oh, Dr. Shah, but I'm not trying to get pregnant. I know you're not. But when you
trying to build it up.
Yeah. we're just building these things up, trying to get you ready. So when
Mhm.
you do, you have your stores and you can create your baby and everything be well. So when your doctor tells you, take some folic acid or your prenatal, we're not trying to get you pregnant. We're just trying to make sure your baby, when you do become pregnant, is healthy, doesn't have any neural tube defects.
Exactly. So we're just trying to prevent some genetic, deformities from happening. So, hey, build up that storage. Pregnancy, the baby draws a lot out of you during that time. So we're just building up that storage.
So another big time in life that it's important to see your doctor is during pregnancy. And I'm just like, I have some highlights. The OBGYNs, they do a great job in this department.
Absolutely.
But for my role as a family medicine doctor, it's oftentimes patients contact me first when they find out that they're pregnant. Then I transition them forward to the OBGYN. So
Mhm.
things that I'll talk to patients about, and even in the preconception, like the pre-pregnancy area, we've mentioned the folic acid. Um, Depression is big, like we talked about mental health earlier, but it's a tough time. Like prior to conceiving, during the pregnancy, and then even after. So I want to make sure that we're not dealing with any postpartum depression or perinatal, like, or depression during the pregnancy. And if we are, we want to address that. Um, Urinary tract infections, they can bacteria can be present in the urine and a pregnant female may not even know. So usually at the OBGYN, they'll check the urine and screen for that. I think if you've been pregnant before, you can remember like a whole slew of blood work. And what we're doing there is we're just checking for infections and other like baseline parameters for overall health and wellness. So hepatitis, HIV, syphilis are common things. If you are a woman who has increased risk for preeclampsia, aspirin is recommended. Your OBGYN will talk to you about it.
Mhm. So what is
Often,
preeclampsia?
yeah. So preeclampsia, I think the easiest way I can describe it is when you have um,
It's hard.
very high blood pressure in pregnancy.
Yeah. So with the high blood pressure in pregnancy, a term for it is preeclampsia. And we just wanted to highlight that to those who are listening, those who are watching, to see that, like, that's also very important during the pregnancy period. So your doc is going to screen for that. So that's one of the things to look out for.
And this is another piece, right? So like throughout your life, if you're going to the doctor each year and we're screening for diabetes, we're screening for high blood pressure, for that season of life, you may not know that the following year you're going to be pregnant. And if we're able to catch these things, treat them when they're pre-diseases, or treat them when they are diseases, like you can have this relationship and really just guide your wellness into a better pregnancy and healthier outcomes for you and your baby.
Wonderful. That's absolutely important.
Yeah. So the next piece for me is infectious disease. So I have this wonderful population who not everybody is born in the US. So my patients, I guess being in Orlando, we have a big demographic of people who may have moved to the US from other countries. So something that I take into account when I'm screening my patients is hepatitis B and hepatitis C screenings and also tuberculosis screenings. So these are recommended. Hepatitis C is also recommended for everybody in the US, ages 18 to 79. And the tuberculosis piece is generally for my patients who may have been born in a country or have some additional risk factors for latent tuberculosis, to screen them and then make sure they get the appropriate medications. So that if they have
latent, let's just kind of break down what that kind of just means to some people, because you hear TB and you're like, well, I'm not coughing, I'm not losing weight. So what is she talking about? Why is she asking me all these questions? So let's just, enlighten the population about like what the latent mean.
Yes, so it means it's not an active infection. It's just like laying dormant in your system right now. And the issues become evident if you were to get sick and you had this laying around, then you're going to get another infection on top of it. And that's when it'll become active tuberculosis. So in the latent phase, when it's just dormant, not, your immune system's doing a good job
Just
of keeping
keeping.
it at bay.
Mm-hmm.
If we diagnose it, then we can treat it and take your medications and you're good. So if by chance, lightning strikes and you become sick, you're
Mm-hmm.
not going to deal with a double whammy.
Wonderful. Wonderful. That's great. And that's why, like I said, Dr. Shah is making sure that these patients are well. She's hitting all the check boxes. All righty. So what else do we have for our patients screening? I see here that we're talking about like alcohol, and I see smoking.
Yes.
Mm-hmm.
So, again, for the smoking, like no judgment from your doctor, really and truly. We know we can help you stop smoking. And if you have smoked or are still smoking, we just need to know. There are some important screenings. So if you've smoked for 20 years, and if you currently smoke or quit smoking in the last 15 years, and you're between the ages of 50 and 80, we do recommend a low dose lung cancer screening, like a CT scan of your lungs, to evaluate for lung cancer.
Mm-hmm.
And then for men, if you're between 65 to 75, we really want to check you for aneurysms in your abdominal aorta, so that big tube of blood that goes from your heart to the rest of your body, it can expand and at risk for rupture even if you've had the smoking history. So we want to screen for that to make sure that that's watched as well.
Wonderful. Wonderful. Now, before we go, there is something that I want you to touch on. Your additional training is in obesity medicine. And, there are a lot of times we're talking about screening. Hey, you should go and get the screening. However, I want to touch on what we feel like, or what we've noticed are some of the resistance in patients whose BMI are a little bit higher and them with screening. So let's talk about that.
So this is an issue that's like pretty near and dear to my heart, especially with the additional like weight medicine training and obesity medicine training. So, across the board, I ask all my patients, how much are you sleeping? What do you eat and drink? What are things that, how are you moving? What's your stress level? Sometimes these questions, because they're asked, the traditional response used to be, okay, you have increased weight, just go exercise and eat less. But that can be a little belittling to a patient who knows that they have a weight issue and is trying. And I'm happy to say that I believe the science is finally catching up to where we are today with weight medicine. But before I get to that piece is when a person has constantly been told to lose weight, all of a sudden there's this barrier that occurs between them and the doctor. And oftentimes I don't have patients come back to me because I've asked them all these questions, or they've been asked questions before, and they feel that the focus of the visit is going to be predominantly around their weight, which they've tried everything underneath the sun to get it down, and they know their risks are high for these other conditions. But what ultimately happens is, if people aren't coming into their doctors, they're missing out on their screenings. So we want that open communication between patients and their doctors. We need them to know that I think we're becoming more aware in the medical culture about weight bias. And what I mean by that is just any additional stigma that there is towards overweight and obesity. We do recognize increased weight as a medical condition, just like diabetes and high blood pressure. It's not a personal flaw. And with that being said, if you have increased weight on your body, you also need to be screened for diabetes, high blood pressure, and all these other issues, just like everybody else. So don't miss out on the chance to get the screenings you need, and then also get the help that you deserve, out of fear of what the doctor is going to say to you, or out of feeling uncomfortable when you're going to get your pap test. like the gown may not fit, or this may be uncomfortable. Find an environment where you're comfortable. I think Dr. Beckford's featured tons of doctors in the US who are approachable and want to help patients. Like, connect with us. We will help you.
Absolutely.
But yeah.
Wonderful, wonderful. All righty. So I think that before we leave, there's one other population that we want to just talk about, and it's the population that can fall. So let's talk about that population, because I think that's so important. And then we will be wrapping this up. But go ahead, let's talk about a population that are at increased risk for falling.
So if you're over the age of 65, you know, I want everybody to have their bones, their joints, and strong bones at that. And so we need to start screening you for osteoporosis or osteopenia at 65. That requires a DEXA scan, which is basically a fancy X-ray that checks to see how dense your bones are. Mm-hmm. So we're looking to see, do your bones are they weaker? Are you more at risk for having injuries in the future? So we know that if a person has weaker bones and if they have a fall, they're just going to have a poor quality of life. So from my end of things is, if I can screen for that, give a person advice when they have, again, that pre-osteoporosis or the osteopenia phase, or just normal bone density, we can start to build up that bone again using medications, vitamins, resistance exercise. Just because you have it doesn't mean that we can't treat it. That's why we screen. We only screen when we have resources available to do something about it, and we do. So I always want my people to be able to walk, move, be independent for as long as possible, and I think this plays a big role in that.
Wonderful, wonderful. I told you guys that Dr. Shah is really making sure that her patients are well. And with her being a family medicine doctor, she can take care of patients from all ages. And we've gone over, so today we did go over just most of the adult screening. Why? Because we know that you guys are gonna go and make sure your kids are good, but you're not gonna take care of yourself. So we want you to know it's important that you also take great care of yourself, that you also go get your screening. You find out if you're whatever. Are you pre-diabetic? Are you pre-hypertensive? Means that you're very close to having high blood pressure, but we want to make sure we reverse a lot of that as early as possible. And as I mentioned, this is really important. Why? Because a lot of us, especially when we're in our 20s, we feel invincible. In our 30s, we're feeling great. It's not until the 40s hit and you look like, well, where did that come from? Well, it's been hanging out for the last 15 years, but you never checked on it. So that's why it's important to get screened, right? As I mentioned, I see a lot of these things in the ER. Recently, I had a patient, 41 years old, new onset diabetes, now he's on insulin. He's like, but I've been fine. I've been great. It's not until 9 days ago that I started to feel bad. Yeah, when was the last time you got an annual checkup? Never, right? And that's what the checkup and the screening is for us to catch all of these things ahead of time. So I tell you guys, all of you guys in Florida, you have a gem. You have a doc down there that cares. Dr. Nikita Shah. I love you, love you, love you for stopping by and dropping all of this great wisdom with us. Before we go, we have 2 quick questions for you, right? Mm-hmm. So one is, you're doing all these great things for your patient. What are you doing for fun? How do you relax?
Well, I live in Orlando, Florida, so I have all the magical parks here to hang out with my kids. I love the outdoors. I have a dog that I love taking out, and I like to travel, but that's been kind of dampened in the COVID season. But yeah, I love going to the beach. I love traveling, and then on a day-to-day basis, just to feel like solid and at peace. I like to read. I like to meditate. And just connect with people like you. It's a good life, and just count my blessings.
Wonderful, wonderful, wonderful. So now that we know all of these great things about Dr. Shah, let's find out, how can we connect with you?
Yes.
Where can they find you?
So I am new to the world of social media, but you can find me at Weight Sense on Instagram, where I talk about all things related to weight and help people make sense of where they are with their weight.
Okay. How do we spell that? Is it
WEIGHT SENSE, Weight Sense.
And Weight Sense on Instagram. All righty. So are you accepting your patients? Because I'm pretty sure after everyone has seen how great you are, there are people who are going to want Dr. Shah to take care of them and their family. Are you accepting?
Yes. So I have two places of work. One is at a hotel and resorts company called Rosen Hotel and Resorts. They're fantastic. So I take care of their employees' family medicines needs. So to see me for family medicine, you would be employed by the company. I also am starting a new practice focused on weight, because this is a true calling for me. I'm in Orlando, Florida, and you can find me at weightsense.com, WEIGHT-NSENSE.com, where I can treat you for weight-related concerns.
Wow. So have you opened
and weight loss
yet, or are we opening?
Yes.
We have.
We're opening we're opening soon. So
you guys,
mid-August.
Dr. Shah is opening soon. You are in a great position because you can be one of her VIP members. So you can be on the list before she opens, know everything that's happening. So you go online and you go to that website and sign up so that as soon as she opens her doors, boom, you are going to be one of the top VIP first set of patients to get this excellent care from Dr. Shah. So go ahead, give us that website again so these people can make sure they sign up.
It's weight-sense.com, WEIGHT-sense, SENSE.com. And I'll be happy to care for you and your loved ones.
Wow. So you guys, hey, you're in a position to be VIP. Hey, what else can we ask for? Thank you so much, Dr. Shah. So this is one of our Your Caring Docs, Docs Who Care. I'm Dr. Tamara Beckford with Your Caring Docs, and you can find us at Your Caring Docs, URCARINGDOCS on boom, Instagram, boom, Facebook, boom, YouTube, LinkedIn, and Twitter, and also on our website at www.yourcaringdocs.com. That is www.yourcaringdocs.com, where all of this great information will be available for you and all of your family. And if you want to connect with Dr. Shah, you can find that link there also. Thank you guys for joining us today, and we will see you later. Thank you, Dr. Shah.
Thank you.
All right.